Hi, everyone. Welcome to US Biotech's first podcast. Today, we're having a conversation that I think is an emerging hot topic. Whether you're already working with peptides in your practice or you're just starting to hear about them and wondering what the clinical case actually is. We have Dr. Rachel Onah with us, and she's going to walk us through the science, the practical applications, and some of the harder questions that come up when we start talking about things like GLP-1s, NAD+, and some of the newer peptides like Retatrutide, making their way into functional medicine. So, Dr. Onah, thank you so much for being here. And before we dive in, for listeners who are meeting you for the first time, I'd love to give you a moment to introduce yourself. If you could tell us a little bit about your background and how you came to work in this space.
Thank you for this introduction. My background is in naturopathic medicine, and I graduated with a Doctor of Naturopathy degree from CCNM Toronto campus in 2023. I also have a Bachelor of Science degree in biology from York University, and post-schooling, I have been working as an ND in both pediatric and family health, where I see a lot of complex chronic diseases, including metabolic health. And I also worked as a pharmacy assistant for 8 years, so I had great exposure into the pharmaceutical world, and that includes peptides.
Fantastic. Thank you for that. And with that, then, let's dive in. So, peptides are everywhere right now. You see them in clinical settings, in wellness spaces, and on social media. But let's start at the foundation. How would you explain what peptides actually are to a practitioner who maybe hasn't started using them yet?
Well, peptides are essentially short-chain amino acids, or they're broken down proteins that act as signaling molecules inside of the body. So what that means is that peptides act as messengers to tell cells what to do. So those tasks could be repairing tissue, regulating metabolism, reducing inflammation, or producing hormones. And your body naturally produces peptides, so it is something that is naturally found within the body, and they do carry out these functions. But if there's dysregulation in those pathways, either the synthesis, which means building up those proteins, or the metabolism, which means breaking down those proteins, then you can have reduced levels of peptides. And that's why researchers have developed peptides as an adjunctive treatment to help carry out the natural function of what they're meant to do. And that really does basically help boost your body's current function with those peptides.
All right, that's a very helpful way to frame it and a great explanation. So I think once practitioners understand what exactly peptides are, the clinical uses start to make sense, which brings us to something that often comes up right away when people start researching these therapies, the side effects. So what are some of the common side effects that clinicians should know about, particularly with NAD+ and GLP-1 therapies?
Well, for GLP-1s, their main side effect is GI related. So individuals on GLP-1s may experience nausea, vomiting, delayed gastric emptying, or constipation. My mom was actually on a GLP-1, and I think it was the first time in 30 years that I actually saw her vomit. I've never seen her sick before. So that was a very eye-opening thing to see, especially as a doctor. You hear about those things, but it's actually more interesting when you see it in real life. And then some of the rarer side effects of GLP-1s is fatigue, headache, and abdominal pain. In terms of NAD, it isn't a peptide, but it's more of a coenzyme, which helps boost the production. And so sometimes with the side effects of NAD can be skin flushing, itchy skin, diarrhea. Sometimes you may experience dizziness, fatigue, and lightheadedness. So those are some of the differences between the two.
So knowing what to anticipate and how to communicate that to patients really does shape how well these peptides are tolerated. Now, beyond the side effect conversation, there's a bigger picture to question. Why are we seeing such a large surge in interest around NAD+ and GLP-1, specifically within functional medicine? So from your perspective, what do you think therapies like NAD+ and GLP-1s are gaining so much traction in functional medicine right now? Is the research catching up, the patient demand, or something else?
That's a great question. I mean, GLP-1s have actually been around for 20 years now, I believe. I believe the first GLP-1, which was called Byetta, was produced in 2005. And it was actually used to stimulate insulin secretion and reduce blood sugar levels. But now it's become very popular, and I think it's for several reasons. I believe that in the Western society, we are now seeing a surge in metabolic issues, especially from, insulin resistance to fatty liver disease to type 2 diabetes. So the demand has increased over the years. I also do think that social media has played a big role with GLP-1's popularity. I remember back in 2022, 2023, I was working as a pharmacy assistant, and GLP-1s were being advertised as a weight loss medication, and there was an extreme shortage of them, and it was to the point that people who have been on GLP-1s for years were no longer able to get access to that medication, and that was because mostly to do with social media. And so, similarly with NAD+, social media has played a role because of its beneficial effects with anti-aging, but I also do think that there's extensive research behind it on how it can support mitochondrial health and also provide cellular repair, leading to anti-aging properties. I think everybody wants to, look forever young, so I think that that's the main keynote with both of those.
Yeah, no, and I do think it's like a combination of all these different things, from newer trends, social media kind of boosting it, but then also there's real science here. So which actually makes me want to dig into GLP-1 a bit more, because the public conversation right now, it's been mostly framed around weight, but that may be underselling what it's actually doing. So from your perspective, what is GLP-1 actually doing in the body beyond weight loss? Because when you talk about patients, that tends to be the headline, but it sounds like the mechanism is much more broader than that.
Yes, so in terms of GLP-1s, it stands for glucagon-like peptides receptor agonist, so it's a very long name, so that's why they shorten it down. But basically, GLP-1s are an incretin hormone that are naturally secreted after a meal. So both the exogenous forms and endogenous forms of GLP-1s, whether a supplement or produced naturally throughout the body, they are taken up in different areas of the body. So there's receptors in the pancreas, in the brain, in the liver, in the muscle, even in fat tissues. And their main function is to help with increasing insulin secretion, increasing glucagon suppression, slowing down gastric emptying, and regulating appetite. So they have multiple roles within the body. As you can see, these receptors for GLP-1s are laced throughout the body, and they really do have a major role with reducing inflammation. They do help reduce the risk of cardiovascular disease. Studies have also found that they improve brain satiety centers and reward pathways so that you don't overeat. And then they also do help reduce risk of certain conditions, such as non-alcoholic fatty liver disease. That's actually been now changed to metabolic dysfunction associated steatotic liver disease because of its role with metabolic issues. And so GLP-1s can play a really big role in terms of improving metabolic health. And so, as you can see, GLP-1s work way beyond just weight loss. They can help with metabolic health, they can help reduce inflammation, and then they also have neuroprotective properties.
Yeah, the systemic effects really kind of do reframe how we think about these peptides. It's very interesting to hear the overall way that it affects bodies. And that kind of naturally raises a question that I think any clinician is eventually going to ask, especially when patients start using these long term and questioning what that might do. So are there risks or unintended consequences that clinicians really need to be sitting with when it comes to long-term peptide use? Things that might not show up early on but deserve attention over time.
There are quite a few risks. There are some known ones. So, for example, the biggest risk when it comes to GLP-1 use is thyroid diseases, or if there's a family medical history with thyroid cancer. Those populations are actually not even allowed to use GLP-1s. And then there are some other long-term side effect use that they do know of. So, for example, lean muscle mass, nutritional deficiencies, that's more due to the side effects. So the nausea and the vomiting and that appetite suppression can lead to nutritional deficiencies. Some clinical studies have also found that it may cause some gallbladder issues as well. Therefore, it's really important to monitor GLP-1s in patients with, blood work or imaging, and just following up and making sure that, even though it does have some therapeutic benefits, making sure that the side effects are also being managed as well.
Yeah, it's kind of a nuance that I think gets lost when these therapies become so popular so quickly. And the long-term effects do eventually matter, and they do matter when you are considering starting them. So let's shift to NAD plus for a moment because it gets brought up constantly in longevity conversations. And I want to make sure we're being precise about what's actually happening at a cellular level. So NAD plus is often talked about in the context of longevity and anti-aging. But what role does it actually play at the cellular level? What is the mechanism that practitioners should understand?
Well, as stated earlier, NAD plus is a coenzyme that is found naturally within the body, and it does have a role with 500 different enzymatic reactions within the body. So that's a lot of use and utilization, and it does have a really important role with redox reactions that are involved in both cellular and mitochondrial health. And so basically the role of NAD plus helps us convert our nutrients into ATP, which is a form of energy, and that helps, aid in DNA repair, gene expression, and supporting the function of the mitochondria. And so NAD typically does decrease with age. So the use of NAD is really and truly there to kind of help restore those declining levels and just improve all of those reactions that is needed with it throughout the body.
Yeah, thank you for that. Understanding cellular role really changes how you frame it to patients. It's not just like a supplement for energy or anti-aging. There's something much more fundamental going on. So that brings me to another question I think a lot of practitioners are wrestling with as they integrate any of these therapies. Where do peptides actually fit in a treatment plan? Do you see peptides as a long-term solution for patients or more of a tool within a broader treatment plan? And does your answer change maybe depending on the peptide or the patient?
That's a great question. I mean, as a naturopath, I think a lot of the things that we use are more as tools. You really want to try and get the patient to be able to naturally be, processing and being able to break down things in their body naturally. But I would say that in terms of GLP-1s, I would say it's more of a tool. It's not really something that you should be using as a standalone solution. Peptide use cannot fix bad habits. So usually even with patients that have type 2 diabetes, if they are recommended with a GLP-1, usually their prescription requires the patient to also make lifestyle changes, and that will help increase the efficacy of that drug. So peptides can help accelerate that process, but if you're not addressing sleep, nutrition, movement, stress, you're basically just layering therapy on top of dysfunction. You're not really getting to that root cause. And the best outcomes come when peptides are integrated with a comprehensive treatment plan. So I'd say that it's a tool to kind of help aid that process, but it doesn't fix that process. And that's why you typically see when people have not made those lifestyle changes while they're on the drug, as soon as they come off of a GLP-1, they complain that, oh, my weight has, come back again, or all of the issues that they had beforehand have come back. And that's because they didn't address the root cause. They kind of put a band-aid to it. So in my opinion, peptides, they can be used as an adjunctive treatment to help personalize and improve their health. But it does change with each patient. The type of GLP-1 that they use changes with each patient. There's short acting, there's long acting. And so that's going to be really contingent on the patient's medical history, their current lifestyle status. So yeah, in short term, it's more of a tool.
Yeah, that makes a lot of sense. It's less about the peptide itself and being a complete answer, but more about whether it's right for the person and how they integrate it within their lifestyle. So with that, I want to kind of get your thoughts on a couple of specific peptides that are generating a lot of conversation right now, starting with one that's newer to a lot of practitioners. So what are your thoughts on Retatrutide? It's been getting a lot of attention lately on social media, and what do you think about it relative to what we already have in the GLP-1 space?
Yeah, that's a great question. Retatrutide, it is an interesting peptide because it actually targets 3 receptors. So it targets GLP-1s, GIPs, and then also glucagon. And so it's almost like a triple hormone receptor agonist, whereas GLP-1s are just strictly one. And this means that it's going to be a lot more stronger or potent than GLP-1s on its own. And this will lead to greater results, in my opinion. So that means greater results in terms of breaking down fat, greater results in terms of boosting metabolic rates. And I mean, it is a newer drug. So what comes with neurodrugs is that there's not a lot of studies out there. There's not a lot of safety data on there. So what's the effects of, activating all three receptors relative to one? That information isn't out there. But from what I have seen, there is a lot of promises and space for this to really help with those conditions that are typically affected, such as insulin resistance, type 2 diabetes, obesity, and fatty liver disease.
Yeah, it's very interesting to see how quickly it's come about, especially on social media. And it's a good example of how quickly I think the space is really evolving. And on a different kind of end of the spectrum, not metabolic but regenerative, I want to ask you about GHK-Cu, because it's one that I find practitioners either know a lot about or have barely heard of. So what are your thoughts on GHK-Cu, and how do you think about it clinically? And where do you think the evidence kind of sits right now with it?
Yeah, that's a great question. In terms of GHK-Cu, it's actually not a popular one that you typically hear about, but it does have really interesting properties. So basically what this is it's a copper peptide that can also be naturally found within the body. So like all other peptides, they can be naturally produced within the body, and you naturally find this in plasma, saliva, and urine. It basically contains a tripeptide sequence that is very close to collagen, so glycine, histidine, and lysine, and it's tightly bound to copper ion, so that's where the Cu at the end of it comes from, and that copper helps with its bioavailability to help with enzymatic processes such as collagen synthesis and as well tissue regeneration. As you stated, GHK-Cu has been used more for localized regeneration and tissue repair rather than metabolic effects. But the main spaces of where you would typically, use this is, topical formulations such as for wound healing, for collagen production, scar reduction, and then also anti-aging. I mean, in terms of its use in the clinical world, I do think that it is something that could definitely be used, especially for, those who are looking for anti-aging properties that are, with lesser side effects. And I think that's the biggest thing. Things that are naturally produced in the body, using it as a supplement will tend to have lesser severity when it comes to side effects. And then, I mean, in terms of research, I think they're still trying to investigate its main role in terms of, gene regeneration, also skin healing. And so I do think that with time and with more research, they'll have more, clinical applications on using it outside of just kind of the cosmetic world, but also for like nerve regeneration and tissue engineering. So it definitely has a great space in what it might come into.
Yeah, it sounds like it's kind of one of those peptides where the science is really interesting and fascinating, and like the clinical applications are still being worked out, and there's just a lot to learn around it still. So I feel like that's kind of a good place to end, actually. So on that note, we can kind of wrap this up. And as we do, what do you want practitioners listening to this to kind of take away as a big message, if there's one thing that you want to emphasize at all?
Yeah, so I would say the biggest thing when it comes to peptides is that it's really a great clinical, medical device that you can use in terms of treatment protocols. I think that it has had a really bad rep because it has been advertised for, weight loss, and social media has really surged. But one thing to know is that it has been around for over 20 years. And so it does have its clinical research on it. It is safe, and I think understanding the physiology of how peptides work can really help you tailor your treatment plans for your patient, and it also enables more targeted interventions that can serve as a bridge towards improved metabolic and regenerative health.
So with that then, Dr. Onah, this has been really informative, and I think it's going to be really useful for a lot of practitioners who are either curious about this space or want to look more deep into what's actually happening, what they're already doing. So thank you so much for your time and your expertise on this subject. And to everyone listening, thank you for joining us for this first episode, and we hope it gave you something useful to take back into your practice.